Hey everybody, welcome back. If you're going on to Medicare, already on Medicare, or just trying to better understand how all of this works, then you're in the right place. On this channel, we break Medicare down in a simple, easy to understand way so you can feel more confident about your healthcare decisions. Today, what we're going to talk about is one of the biggest problems that we see with the Medicare industry as a whole and what we see with our clients facing every single day, and that is how Medicare covers skilled nursing, assisted living facilities, and home health care coverage. So the biggest thing with this is not a lot of people talk about it and not a lot of people think about it, and it is by far the biggest exposure and the biggest asset eater when it comes to draining your retirement, when it comes to Medicare coverage, and any of those big exposures that you need to be aware of. So the biggest thing with this is when people join Medicare and they make a decision on a Medicare plan, a lot of times they think that it's just an all-inclusive plan that covers everything. And that really couldn't be farther from the truth. So the biggest thing that I want to talk about today is skilled nursing, assisted living, and home health care coverage, and overall how Medicare covers that as a whole. The things that you need to be aware of as a Medicare beneficiary, whether you're getting ready to start Medicare, maybe you're a few years away, maybe you're already on Medicare and whoever you have talked to in the past or used as a resource hasn't talked to you about this. Everyone needs to be aware of how this works with Medicare. So we're going to be using a tool right out of the Medicare and You handbook. So everybody on Medicare that's watching this video should have a copy of this. It gets mailed to you every single year. So if you have that, that's what we're using today. And if you start, we're going to be on page 29 here. So the biggest thing everybody thinks, again, when it comes to Medicare, everyone thinks everything is just covered at 100%. And I'm here to tell you exactly how that works with Medicare, skilled nursing, short-term care, assisted living, long-term care facilities. So the first thing that everyone needs to be aware of when it comes to skilled nursing is Medicare does cover short-term skilled nursing facility cares after a 3-day medically necessary inpatient hospital stay. So there's a few terms that I really want you to focus on when it comes to this. The first is 3 days, and the second is that inpatient hospital stay. So if you have a 3-day hospital stay and then you are required to go into some form of skilled nursing, maybe you need rehab, extended rehab, physical therapy, maybe you're just unable to perform all of your activities of daily living, you could find yourself in this sort of situation. So the first thing that you need to be aware of is that 3-day is the minimum mark, okay? The second thing I want you to be aware of is what's called inpatient hospital stays. So in the Medicare industry right now, what we are seeing is a lot of hospitals and medical systems, they are now billing hospital stays as observation stays versus inpatient. And I'm going to come back and talk about this a little bit more, but I think that is something very important that you should write down if you're watching this at home. And I'm going to write it down over here on the side. Observation versus inpatient. Everyone should be aware of the difference for that. Okay. So you could have a 3-day observation hospital stay and then get transferred into a skilled facility, and Medicare won't cover any of those days. So it's super important to understand the difference between observation versus inpatient. So that's the first thing you need to be aware of when it comes to skilled nursing. The second thing, this is another requirement for Medicare to cover skilled nursing, is you do have to show continual improvement. And really how they do that, so if I'm in there, I'm in the rehab facility, I'm getting physical therapy, any kind of services that I'm receiving, and I stop showing improvement or maybe I start to decline, Medicare is going to stop covering that altogether. Okay, so all of those things are super important when it comes to skilled nursing. The next thing here is, how does Medicare actually cover the skilled nursing, the short-term stay when it comes to that? So I've already told you we need a 3-day inpatient hospital stay. We have to show continual improvement. So then how does Medicare actually cover it? Well, you need to know, so assuming I hit those things, the first 20 days, so days 1 through 20, are going to be covered at no cost. So it's $0 each day, assuming you have hit the Part A deductible, which in 2026 is $1,736, okay? The next thing, I do have to show continual improvement. So let's say those first 20 days, I've eaten those up, I'm showing continual improvement still. The next thing is days 21 through 100, you will be responsible for $217 per day. And again, that will be from days 21 through 100. And then the biggest thing, this is where everyone needs to be aware of this, is once I get to day 101, you are responsible for all of the costs. Okay, so only 100 days in a skilled or a short-term care facility like that is a very, very little amount in the grand scheme of things. So this is a huge problem. When we talk to seniors, they aren't aware of this. So this is one of the number one things that we always educate on. Every single person needs to be aware of this. So there's a few things that I want to continue to point out here. So a lot of people get skilled nursing confused with maybe long-term care, custodial care, anything along those lines. And when it comes to this form of care, there's really three versions of care that you need to be aware of. There's skilled care, there's intermediate care, there's custodial care, and I'm sorry, there's four, and then there's assisted living care. So there's four main categories. If you've noticed, right here in the Medicare and You handbook, they are only referencing skilled nursing care. That means there's three other versions of care that aren't covered by Medicare at all. And a lot of people are not aware of that. So I wanna highlight this right here. Medicare does not cover non-medical long-term care. So this could fall anything under intermediate care, assisted living facilities, and custodial care. All of those things, Medicare provides zero coverage for that. So it is super important to understand how that works. Now, just some statistics speaking when it comes to seniors. Like, you may be watching this video right now and say, oh, well, I'm not gonna have a need for that type of coverage. When it comes to seniors today, over 70% of the people that we speak to, Medicare beneficiaries, are going to require some form of extended care. So whether that's in a skilled facility, assisted living facility, or maybe even it's in the comfort of your own home. So what are some numbers that look like that? Well, when it comes to skilled nursing, if the average cost just across the country, and this is gonna greatly differ by what state that you reside in, but the average cost of a skilled nursing facility right now, it's about $115,000 for a year. Okay, and that's just 1 year. When it comes to assisted living, so this is gonna be a little bit lower, and again, greatly depends on the area that you live in. The average cost for an assisted living facility for 1 year is $75,000. Okay, so that's a big exposure. And like I said at the beginning of this call, this is one of those major things that people aren't aware of, and it can totally drain assets, retirement accounts, everything that you've worked for and saved up for your whole life for your retirement, that could be wiped out just from skilled nursing, assisted living, and you never finding out and nobody ever educating and talking about that. So that's the number one exposure that we see when it comes to that. There are a lot of different options when it comes to covering that up. So one of the things that we do here at Greening Health and Wealth, when we meet with clients, we do what's called a client needs assessment. We're asking you a few questions, better understanding your situation and really getting you to understand the different exposures that Medicare has and seeing if you have any kind of plan in place for whether it's skilled nursing, assisted living, anything like that. So there are a lot of different options when it comes to that. Our biggest goal is always to help educate on what do those exposures look like and how can we cover those up. So again, one of the common misconceptions that a lot of people think when they get to Medicare is once they choose a Medicare plan, that those big exposures of skilled nursing, 100 days, assisted living, all those things are gonna be covered by their Medicare plan. So again, using that Medicare and You handbook, we're on page 76 now. Medicare supplements or Medigap plans, which are the number one most popular way to get your Medicare insurance right now. This is the graph that explains exactly what's covered with what plan, and I just want to point out a couple of things here. So when it comes to, I want to highlight this column right here, the skilled nursing facility care coinsurance. So if we look at When it comes to Medigap plans or Medicare supplement plans, anyone new to Medicare after 2020, there's really two main plans that people look at, and that's gonna be Plan G, and that's gonna be Plan N. If you were eligible for Medicare before 2020, you are eligible for a Plan F as well. And I don't want to talk too much about the differences between those plans right now. I really want to continue the discussion about skilled nursing. So if we look here, skilled nursing under Plan F, Plan G, and Plan N, they all say 100% here. And this is a big misunderstanding when it comes to Medicare and skilled nursing stays. So now if you remember just a few minutes ago, I showed you the cost breakdown between days 1 through 20 and 21 through 100. And I'm gonna write it on the board here just so you remember. So days 1 through 20, Medicare covered at no cost. And days 21 through 100 were about $217 per day. Sorry, that's a little small there, but days 1 through 20, no cost. Medicare covers those first 20 days. Days 21 through 100, you as the beneficiary are responsible for a $217 copay every single day up to day 100. So when it comes to this 100%, a lot of beneficiaries think, oh, if I just go into any kind of facility, skilled facility, assisted living facility, maybe a custodial facility, that my Medicare supplement plan is covering that at 100%. And that is not the case. That is not true. What that 100% means is it is covering this $217 copay for days 21 through 100. Anything after day 100, you are still responsible for 100% of the cost when it comes to skilled nursing, assisted living, custodial care, intermediate care. And again, that is going to be the biggest exposure when it comes to Medicare beneficiaries. And really, if I had to pinpoint one thing where there's a lack of education on in the Medicare industry as a whole for our beneficiaries, it is centered around how Medicare covers skilled nursing, assisted living facilities, intermediate facilities, and custodial care. Thank you so much for watching. Hopefully this video helped you better understand Medicare and gave you some clarity moving forward. If it did, make sure to like this video and subscribe to the channel so you can stay up to date with future Medicare content and continue to educate yourself on how all of this works. We also run Medicare 101 workshops 3 days a week where we cover the basics and help you find the best Medicare option for you and your specific situation. And the link for that is in the caption below. If you feel ready for a call, there's also a booking link below, so make sure to check that out. As always, thanks for watching, and we'll see you in the next video.